Richard.
Hello, good morning, Dr. Bart.
We are now about 4 months after the second step in your facial feminization, which was a facelift.
Yeah.
And your first surgery you had
In May, end of May.
last year, May.
Yeah, last year. Yeah.
Okay. I have a few questions to you about the surgeries.
Mhm.
The first one, as always, is what were the problems that you had that made you decide to do an FLS?
Okay. Yeah. You look in the mirror and realise you've got some masculine features, which eats away at your soul, really. Because deep down you're a woman.
Mm-hmm.
Of course, the other one is passing outside, not being misgendered, trying to fully integrate well into the female community, and you don't have that feeling of sticking out. People staring at you is common. We have a word in English called to gawp, which is really intense staring at somebody, not sort of a glance stare, and they are really quite off-putting and makes you feel down. So yeah, the primary reason is for me to feel good with myself when I look in the mirror, to reduce the amount of makeup I needed to apply, and the tricks of makeup to make your face look more feminine, and also to pass better in the street and be accepted more as a female. So those are the main reasons.
Yeah. And why have you decided to have that surgery here with me?
Oh, okay. Well, in 2018, the Transgender EU organisation had their seminar, the conference here in Antwerp. And so the Transgender Support Organisations in Belgium hosted it, part of that organisations, and they provide workshops, seminars, all sorts of things for the transgender community in Europe and a little bit wider. In one of the workshops there was a voice feminization workshop run by one of your Exactly, Katarina.
Yeah.
And yes, I'm sorry if you're listening, I failed your workshop. I'm going to work on it though, so I'm sorry about that. Of course, being a good businesswoman, she provided her card, which was 2+ Clinic. I browsed there and just suddenly realised, wow, there's all these procedures you can do. So that was my start of my journey of finding out all the possibilities of feminising the face and the body, which then triggered your further research. I then came here to start the electrolysis. So I had my electrolysis done here, and that started at the end of 2019. Then there was the COVID started, and that delayed it. But I started to get familiar with 2+ Clinic, and I started to look at a lot of the testimonies that you provide. I started to look at other testimonies, other research, but I always kept coming back to 2+ Clinic. I think I sort of felt comfortable here. I was able to go up to I'm very lucky here because I was doing electrolysis, so I could go up to the guest house, and I could see the world map and the number of patients that come to 2+ Clinic to be operated on. So that was for me a clear statement that you've got a good reputation and lots of experience, and those are some of the criteria you pick on when you're choosing a clinic. Experience, cost. I came to consultation, you gave me a cost so I could compare it with other clinics. Because of COVID, the location became really important, and I live in Belgium, about 1.5 hours away normally, if the trains are on time. So those criteria you look at and find out the ones which are important, and you came out on top. And I was looking also, because of my age, I'm not so young anymore. The post-op support was also very important to me, being able to perhaps get here. That's. I think you're probably one of the best surgeons in Europe, anyway. So maybe the world. So I don't know. I don't want to, but certainly, yeah. When the COVID came in, you know, that criteria of location became, you know, really important. You know, it made a big change, COVID. So yeah, I fell in love with the clinic. I still come here regularly for my electrolysis.
Okay.
So yeah, and yeah, and everybody was nice, and that made a difference as well. I guess I was lucky because you could see the environment in each of the way that people interacted. I'd managed to see the nurses upstairs during sort of lunch breaks. So yeah, it's just a feel-good factor is important. I think if you have that gut feeling, it really does help, which is very difficult to get in other clinics elsewhere in the world. You know, so you just got
been to other clinics?
No, I haven't been to any other clinics. No, I'm loyal
Yeah.
patient of Tupac's clinic, but no.
But you looked at their
I looked at their websites for sure. Yeah, I mean that's important to do your research. And yeah, I looked at many video testimonies. Most of the clinics offering facial feminization surgery do similar videos, yeah, to market their product and market themselves. But yeah, I felt these videos as well, these testimonies are more sincere as well. I felt that the videos were more relaxed and honest.
Yeah, they're
It's difficult sometimes to determine, but yeah.
They're not meant for marketing. They're meant to give information.
Yeah, true. Yeah. Yeah, indeed they do. Indeed they do give good information. But I often, sometimes you feel they're trying to also attract people to their clinic. You know? So.
Can you say something about the result of the surgery?
Yeah, overall I'm very pleased with the results. Yeah, I think because of my age, I'm over 61.
Wow.
You know, the results are very pleasing. Yeah. When I look back at how I was to now, yeah, there's been really a step change in my the femininity of my face, I think.
How's your passing?
That's interesting. It's not, to be honest, as good as I was hoped. I'm still misgendered, not because of the voice. That doesn't help, by the way. Yeah, I live in a part of Belgium where there's a lot of politeness and etiquette. So if you say queuing at the post office or at the apotheker, they often say not next like they do in the UK, next, or in Germany. But in the southern part of Belgium where they speak French, it's monsieur or madame. Mm-hmm. So often it's been a good metric for me. Yeah, they'll say monsieur. Sometimes they then apologise when I get to the counter. But yeah, it has improved, but I was hoping it would have improved a lot more than it really has.
Yeah, I'm surprised.
Yeah, I put it down to. Yeah, I'm a little bit surprised. It's a bit disappointing. I must admit that there are still occasions. Yeah, even the commune, I had to go and get a new ID card, and they used my old photograph prior to the facial feminization surgery, and they said there's no major changes, so they kept my original on my ID card. You'll see. And so yeah, on that side of it, the misgendering hasn't improved as much as I'd have liked.
No.
I just guess I'm just unlucky. Or, of course, it's not just the face, but of course your posture when you're sort of waiting in a queue and things like this. So, but not as big as an improvement as I was expecting. But maybe it gets better. Or maybe I'll move to the Flemish part of Belgium.
Well, I do think that
I think it's
where you live has an influence.
Oh yeah, indeed. Yeah, I mean, yeah, I think they are very respectful and part of the culture, if you like, that they don't say next. They actually say monsieur, madame. Even on the train, you know, they don't say ticket, monsieur, madame. Yeah, I guess it's a fairly good metric on how to judge whether the feminization has really gone well. So, but anyway,
can you tell us something about the healing process?
Okay, the healing process went reasonably well. I was surprised because this major surgery, that immediately after the surgery there was very little pain. I think just over-the-counter painkillers was enough, and I didn't. Of course, there's a lot of swelling, which is quite frightening when you look in the mirror. But overall, after the first surgery, the FFS went well. There was some numbness in the lip and some asymmetrical, so the lip was a little bit slightly down, which affected the speech. So the speech was a bit slurred to begin with, and that went away after about 3 weeks.
Okay.
So that was good. It was a little bit at the beginning, but that was fine. The scarring around lowering the hairline, I got 1 or 2 local infections, which was no problem. I only treated it with an over-the-counter antiseptic cream, so that was okay. I think maybe perhaps a hair follicle got blocked. There was nothing serious there. Nothing that needed antibiotics. Overall, the recovery went well. I didn't feel any discomfort really. There is still some sort of a little bit of discomfort inside the mouth. I think there's a sort of a ridge where the
It's a food infection.
for sort of food collects from the scar, remaining of the scar, which is a bit. I just have to rinse my mouth out more frequently to get rid of it. But overall, it was okay. And then the face uplift, there was a slightly more complications after that. The saliva gland swelled up or produced saliva, which caused the swelling on the left-hand side of the below the ear, and that needed some a drain put in for it to be drained, and another compression bandage applied, but after a week that disappeared and it hasn't returned. So I'm expecting the recovery to be longer than other people due to my age, and it's a fact of life. I can't get away from it. But I prepared myself that the healing would be probably longer and more drawn out than if I was much younger. So I think it's right to mention that the healing process is definitely longer due to my age bracket. I'm in my winter years, let's say that.
You also stayed in the guest house each time, right? Can you tell us something about that?
Yeah, it was just amazing. The only, Petra, the resident guest house person there, is really lovely. She's like, she adopts you like her mother, like your daughter, and the atmosphere is amazing. She's really a lovely person, very kind, offering always good advice and help. And the environment's lovely. The only drawback was, and there's nothing to do, it's not a complaint, was that I was there on my own. So there's no other sort of patients to talk to,
because it was during the lockdown.
Yeah, I was just coming out of it, so things weren't back up to speed. But the other side, I had undivided attention for Petra, so in the evening, that's it. We just chatted, and she's got lots of stories about her time when she was in the fashion industry, and they're fascinating. I was just wow, So although it'd be nice to have some other patients there, that's got nothing to do with with anything really.
No, maybe during the second.
The second one, the second one there was lots, and it was really great to exchange thoughts and ideas and experiences with the other girls there, and they're from all over the world. So that was, again, it's amazing that you can see how trans women are treated in other parts of the country and in the world. So that's lovely. But overall, the food was fantastic. The rooms were large, airy, very, very cleaned every day. If I had something to give you which you could build and make and improve it, I'd give it to you, but I can't think of anything. It's really for the guest house and the accommodation up there, which I could give you and you could improve it. It's really, really great. I loved it up there. It was difficult to leave, and Yeah, and the location in Antwerp's lovely as well because you know there's a park not so far away, a beautiful, beautiful park. So part of the recovery is Petra gets you out and makes you go for a walk, which is it's good for the recovery to get the circulation moving. So yeah, she's really does take care of your well-being and health while you're here, more than you probably realise. Yeah, and it's nice to have. It's called a guest house, but it doesn't feel like a guest house. It feels like you like a home.
Yeah.
She makes it the environment there as if you were entering to a home, and she looks after you more than any guest house I've been to in the past. So it's nice. I like it. And I'm lucky I can, when I come here for electrolysis, I always pop up and
Coffee or soup.
yeah, coffee or just talk to Petra and just give a COVID hug.
Yeah.
But unfortunately, no problems. I really enjoyed it on that.
If you could give your former self as you were before your first surgery, give an advice, something you would do differently, would you have one?
That's a difficult question. If I could stop the clock, turn it back, and I'd have the surgery at a much younger age, really. But everybody's circumstances are different. So, but to myself, I would probably say, don't have too much anxiety. Everything will come good in the end. And sometimes we just, for personal reasons, we can't have the surgery when we prefer it, for many, many, many reasons. But my advice to myself or to other people is, if possible, try and get the surgery done as soon as possible. And especially now, the attitude towards, in my generation, was quite difficult, but now there's a lot more acceptance of transgender people all over Europe. So there's no shame or embarrassment about coming out now. So my advice would mean to me, I wish we could stop the clock, turn it back, and be in this time period now, where it's much easier to be accepted as a trans woman, and much more opportunities to get facial feminization surgery, facelifts, to make you be content with your body and lessen the gender dysphoria, which is a feeling of being unhappy with yourself. So it's a difficult one, that one. But I would definitely have had the surgery a lot longer, a lot younger age. But sadly, and even COVID delayed things. Even it delayed it by probably 2 years to come and get the surgery. So but yeah.
If someone that is interested in having a treatment here in this clinic would like to contact you, would that be okay?
Yeah, that's fine. I'm more than happy to share my experience with anybody if it helps them make a decision. Definitely, I think it's important. So contact me anytime.
That's very kind of you.
Yeah.
And thank you very much for the extensive.
Sorry,
The testimonial. I think it's the longest
oh no,
we've ever
really?
had, but it's good.
You'll have to edit it. You'll have to edit the bad bits.
No, I'm not
Sorry.
gonna edit it. It's very good information. Thank you for that.
No problem. Thank you.